Hi, everyone. It's been another busy couple of months for our teams across the world, so we thought we'd give you a bit of an update on our ongoing COVID-19 response work that you've helped make possible. From the Himalayas in Nepal to rural health facilities in Uganda, you've helped us to save and change tens of thousands of lives. In our remote community development work, you've helped us reach remote communities through essential health and education services and innovative emergency response programs.
Adara is active in responding COVID from the first wave. We were heavily involved in responding COVID and its impact as well on education and health. So let me start with Humla. What we are doing in Humla is that we wanted to make sure that all the health systems are functional even during the COVID time. So that was our first priority. First initial priority to. So we made sure that essential medicine, essential gear for the health workers like the PPEs and also all essential medicines are there in the health posts. And we also wanted to help children with the distance education. We utilized local FM radios in Humla and teachers.
And Nepal again, we have an open border with India, so thousands of people, there's migrant workers. When it's lockdown in India, lockdown in Nepal, many of them lost their jobs and they are coming back to Nepal. So with them, it's thousands of them coming back, and that really increased the spread risks. So to make sure we mitigate such kind of risks, we've been working with Nepal government and some other UNICEF to really work on Nepal-India border to make sure those migrant workers who are entering back into Nepal, they are being properly screened and making sure that we provide them with masks.
And those who are positive, we provide them health kit that's sufficient for their 14 days quarantine. And it's a proper border management. We also started safe residence for the nurse. Those nurses who had a one-room apartment in Kathmandu family, and they work with the people with the in a quarantine, and also ICU, work with the COVID positive people, and they had a hard time to go back to their family and the rented apartment. It was a hard time for the nurses. So together with Karuna Foundation and King's College, one of the prominent college in Kathmandu, we used their building, and Karuna and we started that safe residence for the nurse as well. That's one thing. Other thing, in Gangphedi, in Nuwakot, in Gangphedi, probably the first time we set up the child-friendly children's ward. Actually, we were assuming that this third wave could be very affecting, could be very bad for the children. We work with the local government of Gangphedi to establish 10 model bed for the children.
In our maternal, newborn, and child health work, you've helped us to ensure that these services continue and that facilities are supported to safely treat patients with COVID-19 or other medical needs.
Yeah, this surge was not easy to manage. Adara, we have really gone ahead in responding to this in various ways, and Choko Hospital, as our long-term partner, now acting as a referral center for so many hospitals around. And this was not easy in terms of PPE, but also in terms of managing staff levels, because there were cases where about 50 staff contracted to the hospital. Was so strategic, of course, with the support from the other leadership that were encouraging them to have plan B, mitigate ways how to manage even when other staff are positive, and they were able to isolate them. But above all, they had what they needed to have, like oxygen supply, the PPE they needed for the staff, and other gadgets to use. That was so important, and they were able to help the communities, and then they could also make referrals where necessary.
Throughout this crisis, our amazing team of community health workers have managed to continue their home follow-up visits to the high-risk infants that are discharged from the Chowoko Neonatal Intensive Care Unit into our hospital-to-home program. Where they're unable to visit due to lockdown restrictions, they've been conducting phone checkups. The Adara team also are hosting a weekly radio program that reaches 10 districts across Uganda and covers a wide range of health-related topics each week, including maternal and newborn health, as well as COVID-19 prevention. None of this would be possible without you. So to end, all we can really say is thank you.
I want to thank you so much, our friends, partners, supporters that really stand with us as we continue to do this great work. We don't know when this will end, but we know we have come far and we have reached far because of your tremendous generosity, support.
It's because of our supporters, our donors, our friends out there, who've been standing with us all these years, and especially during all these hard times, that we've been able to do all these wonderful projects in Nepal. Try to change people's lives, try to protect the young children, try to protect women.
So I really, really thank all of you from my bottom of my heart, and we'll do our best to help people in the most remote part of this country.